The outdoors is like a second home to 74-year-old George Houck.
I grew up hiking, camping, and bicycle riding, and I still enjoy doing that to this day.
Staying healthy is part of George's lifestyle, and that includes getting his PSA checked every year.
So if one looks at prostate cancer screening, that involves a blood test, prostate-specific antigen PSA, and rectal examination to feel the prostate.
In 2021, George's PSA was normal, but his rectal examination was not.
He stated that he found a small, somewhat smooth nodule, is the way he described. He said you could call it a lump, but I call it a nodule. And he said it's at the base of your prostate.
Doctors scheduled an MRI and biopsy.
George's biopsy showed multiple areas of prostate cancer, 3 or 4, particularly in the area that looked different on the MRI.
I was surprised, but I'm a very positive person. I have a positive attitude, and I wanted to address it as soon as I could.
Dr. Rahman gave George several options.
For localized prostate cancer, in general, for his type of disease, I talked to George about surveillance, surgical removal of the prostate, or radiation therapy of the prostate.
My decision was based on a lot of factors. Primarily, it was based upon my reading and understanding of the exact issue I had, what my risks were with each type of treatment option available to me at that time.
George thought surgery was the best decision.
It was a robotic surgery, and he did very well with the robotic surgery, recovered quite well. But his pathology really highlighted one important factor, which was he had a lot more aggressive cancer than what we picked up on his biopsy.
It did not surprise me. I was hoping that it wasn't higher, but I was prepared for what was ultimately be the grade of cancer.
I think in George's case, we were fortunate to be able to lead with surgery because I think, thankfully, thus far, he is in remission and there's no evidence his cancer has come back. But I also think it most accurately identified the type of cancer he had.
George's PSA has been non-detectable since the surgery.
I feel great. I don't think I've felt this good in probably 5 years. I have no issues. My wife is very happy of the outcome. She says, "You're doing well."
And George saw a physical therapist before surgery, and he really believes that helped in his recovery.